This is Module 1, Chapter 1.6, and we're going to go over the body plan and different terminology, directional terminology, to kind of discuss and orient ourselves with our anatomy. So, first thing to note is that we have anatomical position. And what anatomical position is having the body erect, you're facing forward, your feet are together, and your palms are faced outwards. And the reason that we do this, and it's extremely important that you always think of someone as a patient in anatomical position, is because obviously all patients can be contorted in different ways. Not everyone is in this perfect anatomical position. What this allows us to do is to provide directional terminology appropriately every single time. So you have a standard of what the anatomy is, and then you can provide directions based on that standard, no matter which position a patient is in. So that's our normal anatomical position. We have other body positions that you can be in, but we always base everything off anatomical position. If you're in a supine position, you're lying facing upward. If you're in a prone position, you're lying facing downward. Now, looking at our guy over here, we're going to look at different directional terms. So we have superior or cephalic, and that is inverse to inferior or caudal. So what happens is as we go towards the head or up through the body, we're heading superiorly. As we go down towards the toes, we are heading inferior or caudally. Now, humans are symmetrical beings for the most part, so we have this midline. Now, as we get closer to this midline, this is referred to as medial. As we get further away from this midline, this is referred to as lateral. We only use superior and inferior when we're talking about the head and the trunk, okay? When we get into the appendages, we start using some different terms. So as you go, appendages meaning the arms and the legs. So as you go from the joint, either the shoulder joint or the hip joint, as you go from the joint further away from the main body, that's referred to as going distally. So your fingers are distal to your elbow. On this side, not that it matters the side in this, but just for our arrow, as we go from our fingers up to our elbow, we are heading proximally, or towards that joint, we are heading proximally. It is extremely important to know these anatomical terms, and there's going to be more that we're going to talk about here shortly. But it is important to understand this because when I'm talking about anatomy, I will refer to everything in terms of anatomical directional terms, and we will use these terms repeatedly. It is very important that for your success in this class, you have these terms down. I will test you on these terms. When I ask you questions, I will use these terms. So it's crucial that you have a very good understanding of your anatomical terminology. So another thing that we have here that there's not a great image of is superficial versus deep. And what that is that in relationship to the body's surface. So your skin, for example, is as superficial as you can get. If you go down to the bone, which is typically in the center of, let's say, the forearm, that is as deep as you could get. So as I head towards the bone in the forearm, I'm getting deeper. If I'm going from the bone and coming up, that is more superficial. But recognize that these are 3D structures, and we'll play with this in class a little bit and probably make a little bit more sense. But superficial and deep is extremely important to recognize. I see students struggle with this a little bit, and hopefully after a few class demonstrations, we can clear it up if it's not clear now. So we're also need to talk about the sides of the body. So are we talking about the front or the back? So typically we refer to the front as the body as anterior or ventral, and the back of the body is posterior or dorsal. Good way to remember this is that posterior and dorsal are synonymous, is that if you think of dorsal fins in sharks, they're typically on the back. That's how I think of it. And yet again, you can see how we have, as you go towards the head, you're becoming more superior, more cephalic. As you're going down, you're becoming more inferior, more caudal. And then once you get to the appendages of the legs, as you're going further from the hip joint, you're getting more distal. As you're going towards the hip joint, you're getting more proximal. So here's all the directional terms that we're going to use. I'm not going to go over each of these examples, but I think it would be good for you to pause the video here, look at these definitions, and I would make flashcards of these definitions. And the best way to really learn these directional terms is to stand up and start moving your finger along your body and telling yourself which direction you're moving your finger. And pretty quickly after that, you should have a very good understanding of the anatomical direction terms. So, body parts and regions. This portion of Module 1 is what I like to call a self-study portion. So you're not going to gain much knowledge from me sitting here pointing to different regions and saying, oh, where your eye is at is what we refer to as orbital. Not much you're going to get from that. So this is something that is going to be self-study. This is good material to make flashcards out of, and I suggest you do so. That's not to undermine and say that this material is not important. This material is extremely important. As we are talking about different regions in class, I will use these terms. Once you get into your careers, as you're taking notes about or writing notes about a patient, you will use these terms when referring to these different regions. Extremely important. We're going to spend a lot of time going over this in class with different activities. But to understand it, make some flashcards, really try to study this so you can come to class prepared, and we'll go over it. Same thing here. So that first image was the anterior. This is the posterior side. Again, pause here, make some flashcards, try to understand these different terminologies. But yet again, self-study. Okay, so now looking at subdivisions of the abdomen. There's different ways that we can divide up the abdomen depending on how specific you want to be. So we can divide the abdomen up into quadrants, or we can do it into regions. So quadrants, quad obviously meaning 4. We can divide the abdomen into 4 different quadrants. So you can have the right upper quadrant, the left upper quadrant. You can have the left lower quadrant and the right lower quadrant. The reason that we do this is when we're describing where pain could be, where you feel like you're having some form of issue or discomfort. We could then write in a note saying, oh, a patient is having pain in the right upper quadrant. What that would tell your caretaker is, okay, they're having pain in a region where the liver exists, where the gallbladder exists, where you have the colon, some small intestines, a bit of the duodenum of the small intestines, a little bit of the stomach. So it allows us to have a better idea of what is causing issues. But it's pretty broad. You know, there's a lot of organs that fall in each of those quadrants. It's not extremely precise. Regions is a bit more precise. So starting where your belly button is at, we refer to this as the umbilical region. To the right and to the left of the umbilical region is the lumbar region. So if you go to the right, you have the right lumbar region. If you go to the left, you have the left lumbar region. Below the umbilical region is the hypogastric. So hypo means below, gastric for stomach. So you're below the gastric here, or below the stomach. So that's what we call this midline inferior portion. And then to the right and to the left is the iliac region. The iliac is the part of your hips that exist here. If that helps you remember, so you have the right iliac region and the left iliac region. Now, as we go superiorly, you have the epigastric region. Epi means on top of, so gastric means stomach. So right on top of the stomach is the epigastric region. To the right and left of the epigastric region is the hypochondriac region. And obviously, if you go to the right, you'll have the right hypochondriac region. The left is the left hypochondriac region. It is important that you understand these different subdivisions of the abdomen, have a general idea of which organs fall in each of these regions and or quadrants, because it is extremely clinically relevant and will be extremely relevant for your careers. So now we're going to look at different planes throughout the body. So we talked about imaging earlier, and imaging is the main way that we're going to look at these different planes. So the sagittal plane is going to divide the body into left and right halves, not necessarily equal halves. That's where a mid-sagittal or a median plane comes in. And this is a sagittal plane that's directly down the midline of the body. That will give you two halves that are roughly 50% each. Now the frontal plane or the coronal plane, this is going to divide the body into anterior and posterior sections. The transverse plane or the horizontal plane is going to divide the body into superior and inferior sections. And an oblique plane is a plane that's going to occur at something other than a perfect right angle. And we'll show some images to clear this up. So looking here, this first section that we're looking at is a transverse plane. This is separating a superior and an inferior portion. So you can see we've done this transverse plane through her brain here. So there's a superior portion of her brain and skull, and then an inferior portion as well. We'll also call this a horizontal section. This section here is a coronal section. So this is when we're separating things between anterior and a posterior portion. So you can see here that we have an anterior portion of the brain, a posterior portion of the brain. And then down here, you can see that we have a sagittal plane. So sagittal plane is separating the body in left and right halves. So if we do a cut vertically up and down, that is going to be a sagittal plane. Something I did not mention up here for coronal plane, the way that I like to remember this is coronal reminds me of crown or corona. So what that does is when you put like a little crown on, it's going to separate. There's a little hand gesture I'll show you guys that will help you remember that coronal plane separates between anterior and posterior portions. Now, when we're looking at planes through an organ, there's different ways that we can look at it. So we can have a longitudinal cut, which is going to be cut along the length of an organ, which you can see here. This is the intestine. So this longitudinal section provides this really long cut through this entire part of intestine. Now, a transverse cut or a cross cut, this is going to be a perfectly perpendicular to its orientation and give you, in this case, the diameter of the intestine. It's going to be cut at a right angle or perpendicular to the length of that organ. But when you have an oblique cut, you can see how this is not at a perfect right angle or perpendicular to the flow of the intestine. It's a little bit at an angle. And that's what we'll refer to as an oblique cut. It's important to recognize this because as soon as you go to a oblique cut, it really does change how an organ is being viewed. So you can see in our transverse section how nice and round this piece of intestine looks. But when we have this oblique cut, not at a perfect 45, it kind of elongates or ellipsates that section to make it look a little bit bigger than what it actually is. So now we're going to talk about body cavities. The body is going to contain both ventral and dorsal body cavities. The dorsal body cavity is going to consist of two smaller cavities, the cranial cavity, which is going to house the brain, and then the vertebral canal or spinal canal, which is going to house the spinal cord. The ventral body cavity has many more cavities than the dorsal body cavity does. It's going to have different divisions within those cavities. So it's important to really understand what we're talking about and how to divvy up these different cavities, or the ventral body cavity is going to be quite confusing. We have the thoracic cavity. The thoracic cavity is where you are going to find your heart and your lungs. It's surrounded by your ribs. And we can further divide that thoracic cavity into the pleural cavities, which are going to surround each lung. We have the mediastinum, which is going to be found at the midline. And that's going to contain some other large structures, such as the trachea, heart, the big blood vessels, which we refer to as the great vessels, the esophagus. And we'll actually talk later about how we can divide the mediastinum up into even a smaller cavity, which is the pericardial cavity that surrounds the heart itself. So the other main component of the ventral body cavity is the abdominal pelvic cavity. And this is going to consist of the abdominal cavity and the pelvic cavity. The abdominal cavity is going to contain all of your digestive organs, such as the stomach, liver, spleen, intestines, things like that. And the pelvic cavity is going to contain the urinary bladder, the urethra, the rectum, and the reproductive organs. So now we'll show some images to kind of help visualize this a bit better. So as you can see here, what's in green is known as the dorsal body cavity. So you have the cranial cavity, which is going to house the brain. You have this vertebral canal or spinal canal, which is going to house the spinal cord. And those are both components of the dorsal body cavity. Going to the ventral body cavity, you have the thoracic cavity, you have the abdominal cavity, and you have the pelvic cavity. So we're looking from a lateral view here. I want to go and look at this anterior view. So here we have our thoracic cavity, which is this region. We have our abdominal pelvic region, which is here. So looking strictly at the thoracic cavity, you see a cavity here and a cavity here. Those specifically are going to be your two pleural cavities. So that's where your lungs are going to sit. Those are found within the thoracic cavity. There's just little subsets of the thoracic cavity. At the midline here, you have the mediastinum. The mediastinum is the cavity that's going to be found at the center. That's going to hold the great vessels, the trachea, the esophagus, thymus. It's going to contain the heart. Now, what you'll see is the mediastinum is actually can then be broken up into another smaller cavity. It's labeled as mediastinum here, but we'll talk about it later. And this will end up being the pericardial cavity where the heart sits. So the pericardium surrounds the heart. Now, when we go to the abdominal pelvic cavity, you can see here in purple that this is the abdomen. This is where all of your digestive organs are going to be. And then inferior to that, you're going to have the pelvic cavity. This is where many of your urinary organs, reproductive organs will be found at. One thing to note is that you see this divide here separating the thoracic from the abdominal pelvic cavity. This divide is known as the diaphragm. That's the muscle that helps with respiration or your ability to breathe. Ventilation, not respiration. Your ability to breathe. And that's what's separating the thoracic from the abdominal cavity. So now we're going to talk about serous membranes. So what serous membranes are is that they're membranes that are going to cover the organs of the major body cavities and going to line the cavity itself. In the image below, what you're going to see is that the fist that's put into this balloon here is representing an organ. So we have two different types of, or two ways that we break down serous membranes. So the portion of the membrane that is directly on the organ, this case, which is our hand, that's going to be known as visceral. Visceral means organ. So the part of the serous membrane that covers the organ is going to be known as the visceral portion. This outer part of the balloon that's going to line the cavity, that is known as parietal. The way that I remember that is parietal means perimeter. So that's on the outside lining the body cavity. The cavity between serous membrane space, if you will, this is going to be filled with a lubricating serous fluid. And what that does is it helps reduce friction between the movement of organs, because all of our organs are moving, especially the lungs and the heart, constant beating and inhaling and exhaling. That fluid between those two cavities prevents rubbing and getting caught on each other, and it reduces the amount of friction. Now, we talked about visceral versus parietal membranes, but we kind of left it at that. But what we can do to make it more specific is looking at the different membranes of different organs. So the pericardium, I've talked about this. This is the serous membrane of the heart. So pericardium is going to surround the heart. It's going to contain the pericardial fluid. The pericardium that is directly on the surface of the heart is the visceral pericardium. The pericardium that is around the pericardial cavity is going to be known as the parietal pericardium. The serous membrane that's going to surround the lungs is known as the pleura. So this is going to surround the lungs, and that's going to line the thoracic cavity. It's going to contain pleural fluid. That's going to help reduce friction. Visceral pleura is found directly on the surface of the lungs. Parietal pleura is found on the perimeter of the thoracic cavity of the pleural cavity. When we get into the abdomen, we refer to the serous membrane as the peritoneum. This is going to surround many of the abdominal organs. It's going to line the abdominal pelvic cavity, and it's going to be filled with peritoneal fluid. If it's on the organ itself, it is visceral peritoneum. If it is on the cavity wall, it is parietal peritoneum. Now, continuing with peritoneum, we can kind of discuss this a bit further. Within the abdomen, we have what's known as mesentery, and this is regions of double-folded visceral peritoneum, and this is going to attach to certain points on the posterior portion of the abdominal pelvic wall. And this mesentery acts as a pathway for blood vessels, nerves, lymphatic vessels to reach all those digestive organs. But it also provides as some form of anchor to hold those organs into place. Some organs can be known as what's called retroperitoneal, and that means behind the peritoneum. Parts of an organ or the entire organ itself has the ability to be retroperitoneal. Um, and this is when there's only going to be peritoneum um, covering one side of that organ because it's actually behind. So one side will have peritoneum, the other side will not. Intraperitoneal is when the whole organ will be covered within this peritoneum. And we'll show some pictures of that. Hopefully it makes visually a little bit more sense. So inflammation of serous membranes, you've probably heard of some of these issues before. It's very common to have inflammation due to some form of infection or trauma within these different serous membranes. So if you have pericarditis, that is inflammation of the pericardium. If you have pleurisy, that's inflammation of the pleura. If you have peritonitis, that's inflammation of the peritoneum within the abdomen. That is the end of Module 1's information. In class, we'll go over some images looking at the visceral versus parietal peritoneum. We're going to do a lot of work with the different anatomical directional terms and also the different anatomical regions.